This year's U21 International Student Challenge, Team 2 brings to you adaptation policies in healthcare in the case of extreme cold weather.
On our Team Blizzard Busters, we have leader Emily, organizer Raymond, designer Nazia, challenger Vincent, and supporters Steph and Luyanda.
This presentation will link the current situation in China with the policies in place in Canada, and our proposal has been developed based on this connection.
Climate change is known to cause global warming. However, as a consequence, new regions are experiencing extreme colds and need to apply new public health policies to fight the emerging health issues.
China's current status and the recent changes due to climate change. China has recently seen increased freezing weather due to climate change. According to research conducted, the cold conditions in China have led to mental health effects in the population, such as stress and anxiety, which are likely to lead to suicide. The cold conditions in China have been found to be the cause in the increase in carbon monoxide poisoning cases, which are likely to lead to mortality. And these conditions have also been found to escalate the mortality rates from respiratory and cardiovascular diseases in the older populations of China. It also increases susceptibility to other infections and influenza-like illnesses. Another growing concern in China due to the icy conditions, it is the increase in the hypothermia cases that results in the rise in mortality rates.
Luanda has talked about how China is experiencing the effects of extreme cold weather. We advise that China can learn from some of the policies in Canada, as Canada has a long experience in dealing with extreme cold weather. The two policies that we are going to talk about are SSHA Department in Toronto and the Public Health Promotion in Canada. The Shelter Support and Housing Administration Department, also known as SSHA, has a series of policies to help homeless people during cold weather. The two most iconic policies are for warming centers located in Toronto and the 24-hour winter respite sites. The difference between winter respite sites and warming centers is that winter respite sites operate all the time during winter, while warming centers only opens when the temperature is minus 5 degrees Celsius or when the winter event warning is activated. It opens at 5 p.m. that day until it is determined to close. Although China has shelter for homeless people, there is no specific shelter which operates only in extreme cold weather. Government can set up departments like SSHA and have policies like setting up warming centers apart from the ordinary shelters to provide more space for homeless people during winter. Now I will give the time to Raymond.
In Canada, public health promotion is also used to deal with extreme cold. The government agencies collaborate with each other and they aim to maintain and improve public health, provide accessible basic information, and raise the awareness towards extreme cold events. The first example is an informational guideline published by Health Canada, which is called It's Your Health, Extreme Cold Edition. It includes background information, what people can do, and government's role and collaboration. The second example is through healthcare professionals and employers. The Toronto Public Health enhanced outreach and communications to healthcare professionals and provide information on various health impacts to vulnerable groups. The Canadian Centre for Occupational Health and Safety provide information to the employers to minimize a worker's exposure to extreme cold events. And one example is hierarchy of controls. China is a large developing country and its healthcare coverage and quality in many rural remote regions are inadequate. With a lack of immediate medical accessibility, public health promotion can be used as a cost-effective method. China should encourage collaboration between government agencies to provide informational guidelines, provide information to the healthcare professionals about vulnerable groups, and give guidance to the employers to protect their workers.
Finally, as a recap, extreme cold weather is rising in new regions, which means countries are not prepared and varied health risks arise from it. Vulnerable populations, especially homeless and the elderly, are most at risk. China has a rising problem in homelessness and people living in unsafe conditions, which calls for a need for policy changes and adaptation. Canada is a role model for solutions to this problem. Their main adaptations include setting up the SSHA and promoting collaboration between the different health departments. Therefore, our main solution is to focus on public health and adequately allocating resources for this issue.